name is Dr. Kyle Murray. I am with Atlas Brain Spine in Upland, California, and we are a NUCA chiropractic office, which is a specialty of upper cervical chiropractic, and I'm one of the doctors there. So for patient feedback and ongoing assessments, we want to make sure the patient is progressing. Of course, we're looking at objective changes, and they are going to be experiencing what they're experiencing within their body subjectively. So we always will do, within the first half of that initial phase of care, we will take another x-ray from the front. So we are getting a nasium view to make sure that the actual correction is still correcting the proper position. If there's anything that we need to change and alter on how we're adjusting you, then we're able to make those changes right away so that we are maximizing your body's ability to heal and stabilizing that upper cervical region. And then we also get to check in on how they're feeling, kind of where they're at. Then we do the re-exam process. The re-exam, we're measuring the scans that we did when they first came in as new patients, and we're comparing that to now a couple months later, where we're able to objectively see the differences between the surface EMG. We're able to see the difference with the heart rate variability. We're able to see even x-ray from the lateral, which is the curvature of the neck, and how much anterior head carriage there is. And if it's starting to reduce and it's starting to come back, we're seeing if that curvature is starting to reshape and reform. We're able to have all these comparison tools to see what's going on top of the actual postural assessment too. And then during care, along the ride, there's always going to be things that can cause you to shift out of place. God forbid you have a car crash or something along those lines, and that may necessitate then a new film. And so if the person is not holding like they used to, clinically showing that they are constantly going out of alignment and other symptoms might be showing up, then that gives us clear evidence that we need to check to see if we're adjusting you properly. We'll go through like a troubleshooting process. And so we love to use the troubleshooting process because if we're able to then get you back and get you corrected properly, that allows for the body to begin the healing process again. Ultimately, the patient starts to get better and better and better versus plateauing. If you're starting to plateau, if you're starting to drop back down, then we know that we need to reassess and see what's going on to make sure that we're continuing to improve in the direction that we want to. So the process of re-exams in our office, it's really important to make sure that we're optimizing your care. And so we do check in very often. So especially during the first initial phase of care when it's really intense, we're checking in and making sure one time at the about 30-day mark, again at the second month, and making sure that the body is continuing to progress the way that we anticipate it to. And then that way we have a comparison as well. We have the objective data. And so that is really, really important for patient care. If we need to alter something or change something for your care, and that's why, again, it's personalized, then we can do so.